So thank you very much for being here. I would like to welcome you to this wonderful Congress we have been organizing to try to attract the best advances in the field of cancer. I have to tell you that we have been extremely flexible and to attract the best information. And I have to say that those almost 3,000 papers we got, some of them, the late-breaking papers, were accepted only 2 weeks ago. So this was a great opportunity to bring here very good material, very good information. So as Professor Peters said, we have an excellent and very full scientific program that should provide many opportunities for press. So I'm going to explain very briefly how are we going to organize those 1,600 papers that have been accepted into the Congress. And I would like to recommend you to pay attention particularly to the Presidential Symposium, because we selected for that 3 sessions. That's one of the first points I would like also to underline. Classically, we only have 2 presidential symposiums because of the amount of good stuff, practice-changing information, we decided to promote these papers in the format of a presidential session. And then we need 3 slots to fulfill this requirement. So in the presidential symposiums, the best abstract containing cutting-edge and significant clinical practice-changing studies are going to be presented. And after that, there will be a discussion led by a discussant on the meaning of these important advances. Of course, we have also oral presentations according to the different type of tumors we have organized our program. So those selected for oral presentations are original data of outstanding quality, and they are going to be also followed by an expert discussant putting into the context the findings we are getting. And also we have posters, we have poster discussions, we have a lot of educational sessions, but the real key things are in these 2 formats, or in the presidential session and the oral proffered papers. I'm not going to go to all details, but of course to facilitate discussion among experts in the poster discussion session, after visiting the posters, the experts can meet in a room and to discuss the finding of the most outstanding posters. And there's also some others that are going to be reviewed only by an expert. So the real breaking news that are going to be presented in the presidential symposia are these. I'm going to underline these studies. We have studies indicating important advances in common and high prevalent diseases like lung or breast cancer. But we are also important information in other diseases that are not so prevalent, like ovarian cancer or melanoma or even sarcoma. I would recommend you to follow the Monaleesa 2 study, which is going to change practice in advanced breast cancer. We have also the ENGOT NOVA study is on ovarian cancer, bringing a new group of drugs called PARP inhibitors into the treatment of relapsed ovarian cancer. Just to underline the importance of some of the stuff to be presented, we are going to be concomitant two publications in the New England Journal of Medicine, this one of melanoma showing some effect of immunotherapy in patients after surgical resection, and we also have some important studies mainly on immunotherapy in lung cancer that are going to be very, very relevant. And that's the summary I would like to present to you. So thank you very much.